To Mr. Speaker, Dr. Kevin McKinney, Dr. Rachel Villanueva, Dr. Cedric Wright, to the past President's Council, officers, trustees, delegates, and members of the National Medical Association. Thank you and good afternoon to you all. I know that you were expecting our Assistant Leader, Jim Clyburn, who was not able to be here today. So I'm his stand-in, so forgive me. Anything that goes wrong, blame it on Jim and not me, because he couldn't be here today, but it is my pleasure indeed to be with you. I am so pleased to be here because your mission embodies so many of the philosophies that many of my colleagues and I fight for every day in Congress. And I thank you for serving as the collective voice of physicians of African descent and a leading force for parity in medicine. I join you in your efforts to eliminate health disparities and to promote optimal health. Dr. Martin Luther King Jr. noted, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. I know our country is better because you are serving its healthcare needs. And I've got your back in Washington as I work toward wiping out harm and injustice once and for all. I serve on the Agricultural Committee, and as I thought about coming here today, I thought about the things that affect our people in particular. 2 weeks ago, our committee voted to cut SNAP or food stamps by more than $16 billion. They voted to take 200,000 children out of Head Start. They voted to cut funding for childhood diseases. This is the place I work every day. It is a shame because that is the harm and injustice that I fight every day. I come from Cleveland, which the speaker indicated to you, and I am very boastful in a lot of ways about the world-class medical institutions in my congressional district. Is there any, I know that we have some physicians here from Ohio. It's good to see you. But in my district alone, I have the Cleveland Clinic, University Hospitals, Metro Health, Rainbow Babies and Children's, and Sheridan. We have some of the best health care in the world, but so many of my young people cannot go there. That is the shame, that is the harm and the injustice. Our hospitals are leaders in research and quality patient care, to the point where the U.S. Department of Health and Human Services awarded millions of dollars to our hospitals for initiatives that related to medical research, training, and innovative patient care. Programs that have shown great success. Like many of the members of this august body, physicians are working to increase the quality and access of care to vulnerable populations, while reducing avoidable visits to the emergency room and lowering costs. I'm also pleased to say that we strive to be an example for healthcare facilities that are working to ensure that providers reflect the diversity of our communities and the communities they serve, not just from the physician ranks, but from the professional ranks as well. Even though we're moving in the right direction, we still have a very long way to go. Yes, diversity is important, but so is access to quality health care. I look forward to the day when excellent health care is affordable and accessible to all Americans, regardless of their race, their color, ethnic background, or economic demographic. Do you realize that today in this country, 22% of all African Americans are uninsured, and 32% of all Hispanics are uninsured? That's what the new health landscape ought to be. That is why I'm so proud to have been a supporter of the Affordable Care Act. And it has provided the right foundation for that reality. It is going to move us to the place we need to be. It's a great beginning. Is it perfect? No, it is not perfect. Nothing perfect comes out of Washington, D.C., let me tell you that for a fact. And then let me talk to you just a bit about the importance of the Supreme Court's decision to uphold the Act. It cannot be overstated because the Act has already accomplished a lot of things that people don't even realize. Today, the law prohibits insurance companies from imposing lifetime caps on health benefits. which is already helping more than 100 million Americans. This means that people won't lose their insurance when they need it most. In my district, there was a young couple who were having trouble conceiving. So they went to their insurance company who paid for in vitro. The insurance company paid for it. They were blessed with twins, the prettiest little girls you ever want to see. The health insurance company decided to insure the twins and not the parents, because the parents now have a pre-existing condition because they could not conceive. This is the world we live in. I know you think it's crazy, but it's the truth. And insurance companies are now required to spend at least 80% of your premiums on actual care. So a lot of people are going to be receiving a rebate from their insurance companies this year because they didn't spend 80% of your premiums on their care. They further cannot deny children coverage if they have pre-existing conditions. Another child in my district born with a heart disease. By the time she was 2, her parents had capped out of her insurance. They had spent $100,000. But this is a child that's going to need surgery more than just what has already occurred. So you know what they pay for her insurance right now? $30,000 a year for a 2-year-old. This is the country in which we live. When we talk about not denying children with pre-existing conditions, we're talking about 17 million children whose conditions can no longer be denied coverage by insurers. In its first 2 years, the Affordable Care Act has already enabled 6 million young people to remain on their parents' health care plan until they're age 26. Without the act, more than 3 million of them would not have been insured. I was so struck by the Colorado shooting last week, where they talked about the majority of the young people who were shot and injured had no health care. Had no health care. They're trying to figure out now how to create an environment in which they can assist them with paying their bills. People are having fundraisers for them. And some of these same people who are doing this today think the Affordable Care Act doesn't work. If it didn't have an Affordable Care Act, just think where people would be for generations to come. Many states like mine have received resources from the National Health Service Corps to assist in repaying educational loans of healthcare professionals who agree to practice in underserved areas. This is particularly important to minorities, and it is happening across the country. This act also focuses on wellness care, not sick care. And that's consistent with the oath many of you take. And I'm going to paraphrase, but it says something to the effect, I will prevent disease wherever I can. For prevention is preferable to cure. In 2011, 32 million seniors received 1 or more free preventive services, and 14 million have already taken advantage of these services in 2012. Services such as cancer screenings and colonoscopies. And in an effort to increase the number of patients served and expand preventive and primary health care, health centers in my home state have received more than $54 million to create new to assist new sites for medically underserved areas. And let me tell you what, poor people would rather go to a health center than they would to go to an emergency room. The health care is accessible because it's in their neighborhoods, and it's less expensive than going to the emergency room. And I want you to understand this. More than 1/2 of all adult Americans will have a pre-existing condition in their lifetime. Acne is a pre-existing condition. Diabetes, asthma, obesity, things that nobody thinks about are, in fact, pre-existing conditions. If you have a cesarean section, it is a pre-existing condition. If you are pregnant, it is a pre-existing condition. More than 1/2 of all Americans will have one in their lifetime.